much again for the introduction, for the opportunity to be here with you today and contribute to what has already been a very engaging session of presentations. I look forward to sharing with you some of my early work around the role of school nurses in addressing social determinants of health related to childhood obesity. So as far as a brief outline of what I'll be covering, I do want to provide a brief introduction specifically to the positionality and lens in which I approach the work that I do. And I appreciate the introduction previously given, which will help frame that. And then I'm going to dig more deeply into a case study of one specific nurse-led childhood obesity intervention, including how the intervention was implemented and its effectiveness, and how we can understand that implementation and effectiveness and really thinking about the context of the social determinants of health. And then ending by sharing some of my thoughts around what's next and looking forward to hearing some of your thoughts and the other presenters' discussions on what could be next in this space and related spaces. So here I've included my positionality statement. I typically tend to be averse to very text-heavy slides, but because I think this is important, I've included it word for word here, but I'll briefly summarize it narratively for you. I believe as a scholar that one's identity certainly influences the work they do and the way they approach it. So I want to share a bit about my own background, identify as a woman and as white. I'm a faculty member at a large public research university in Philadelphia in the United States of America, which is a community that, while it has many strengths, has also experienced a lot of barriers related to social, economic, and racially driven marginalization. Most of my research, as was mentioned, focused on social determinants of health, particularly in populations affected by trauma. But an important part of that research for me is directly engaging with patients to inform how I understand my work, ask questions, and interpret my work. So I do maintain an active clinical practice in the community in which much of my research is based. So with that, I would also like to amplify the fact that I don't do this to speak for the populations I study, but to leverage some of the privilege that I hold to help amplify their voices and the importance of the issues I study. So with that, let's shift gears to speaking about school nurses and obesity. So I have here two screenshots from the first pages of articles, one published several years ago and one published more recently, in which I was involved that examined the evidence and found that school nurses or nurses based in school settings can be really important stakeholders in helping to reduce childhood obesity. And that's what the literature as a whole tells us. But let's think together more deeply about one particular intervention that I was involved in helping to evaluate. And that's the Healthy Options and Physical Activity Program, or HOP. HOP was a school nurse-led intervention for kindergarten through 5th grade children with class 2 to 3, what we historically called severe levels of obesity. It was implemented here in the United States by the New York City Department of Mental Health and Mental Hygiene and the New York City school system. The program itself entailed one-on-one counseling sessions with a child and a school nurse with an intensity that was dictated by the nurse, but meant to be at least once every 6 months, with time focused on health behavior education, goal setting, and BMI tracking, really focused on obesity-related health behaviors, sugary beverage intake, screen time, physical activity, etc. And the New York City school nurses were provided with training and resources, but there wasn't a particular structured curriculum. They were given a lot of autonomy to tailor the program as they saw fit for the children they were working with. So how were eligible children in New York City potentially enrolled in HOP? Well, in the New York City school system, the BMI percentile of all students is measured annually as part of their physical education. And for students who had a BMI greater or equal to the 99th percentile, which was New York City's metric for determining highest levels of obesity, a letter was sent to the parents explaining the HOP program, and opt-out was offered. And if the parent didn't opt out, the child was then eligible for enrollment by the school nurse. So essentially, if the parent didn't say, I don't want my child to participate, the nurse had the opportunity to enroll that child. And if a child was enrolled, their actual engagement with the school nurse focused first on just an assessment of comorbidities, assessing the child's BMI percentile, providing, of course, some health behavior education, setting goals, and providing some take-home materials for the child and family. with follow-up sessions then being focused on measuring the BMI percentile again, providing additional health education and revising goals as needed based on progress, and ensuring the child and their family were linked to school and community resources as needed. And all of these sessions occurred one-on-one between the child and the school nurse, as I mentioned previously, though parents and caregivers were invited to participate if able. So my role in this project was, after HOP had been in place in New York City for several years, I came in to do an evaluation study in collaboration with my Department of Health colleagues to evaluate how HOP was being implemented, if it was working to improve health behaviors related to obesity and decrease BMI percentile, and also to better understand school nurses' experiences implementing the HOP program. And those first two items related to implementation and effect on behavior and BMI percentile were assessed via a quantitative research study, though the third bullet was assessed via a qualitative research study or interviews with school nurses. Oops. And because the focus of our work today is in part how school nurses can play a role in addressing social determinants of health, I just wanted to provide a little bit more detail and examples of the types of interview questions we asked school nurses. These were developed using a framework called the RE-AIM framework, which is a theoretical framework that can be used to help evaluate an intervention's implementation and effectiveness. So it's just exemplars here. So when we began our evaluation, what did we find? Well, in New York City, almost 21,000 children were eligible for HOP, which is 5.7% of the student population. That's a very large number, but the New York City school system is a very large school system with over 1 million children. So even if only 5.7% are eligible, that's a lot of children. The demographics you can see in the table below, I won't read them to you, but you can see a larger percentage of the sample that were eligible were male, of Black race or Hispanic ethnicity, and were approximately 7.5 years old. That's about consistent with what we see when we look at the demographics of youth with this level of obesity in New York City. In particular to this presentation today, I did want to highlight that we looked at some of the contextual factors impacting these youth, that children eligible for HOP lived in high poverty environments or lived in neighborhoods where an average of 1 in 4 of the families that lived around them were living below the poverty level. When we looked at implementation itself, we determined that HOP implementation was actually quite rare. Less than 1% of parents opted their child out, yet only 1,049, or 5.1% of the eligible children, were actually enrolled. And of those who were enrolled, they participated in an average of, or a median of, 1 session per school year, so quite low intensity. And parent presence was quite infrequent, with parents being present at only 3.2% of HOP sessions. And not surprisingly, given the context for that low intensity intervention, there was no effect on change in health behaviors or BMI percentile. And interestingly, given that low enrollment rate, we wanted to explore what factors were most associated with an eligible child receiving HOP, or a child who is eligible HOP actually being enrolled by the school nurse. And the strongest predictors were a child attending a school with a lower nurse workload or less school poverty. So essentially, if a child attended a school where the nurse was less overworked or there were more financial resources, the child was more likely to receive HOP if they were eligible. And the school nurse interviews we conducted were really important to giving context to some of the social and environmental factors that were influencing why we saw what we saw when we evaluated the implementation and effectiveness. So we spoke to 19 nurses from all different areas of New York City, different levels of experience. And one of the main findings from those interviews were that the social and environmental factors were really important to understanding HOP. So I'm going to provide some example quotes of how that came to light during those interviews. So first things first, this relates to the presentation we just heard, thinking of food insecurity, food environment. A lot of the nurses recognize the importance of the context of the nutrition environment around where children were living and attending school, with one nurse noting, "There are too many fast food chains in the neighborhood where my school is. So if parents can get fries and soda and chicken nuggets for $1.99, why would they cook?" Parent beliefs about obesity and the school nurse's role were notable as well. One nurse noting, "I can't even begin to tell you the phone calls that I received. It was basically, how dare I intrude?" Many parents felt that this was not the school nurse's role to intervene on obesity, especially for such a sensitive topic. School culture played a role as well. The culture of an institution or an organization is always important, and that was the case here. Some nurses noting that as a facilitator. So for example, the teachers at the school where I am are very receptive. That helps a lot. I don't have any of the students saying, oh, or the teachers saying, oh, you can't take the student out of class for HOP. Social discrimination was another substantial concern, particularly weight-related bias. One nurse being concerned saying, yeah, it's bad enough being a heavyweight child, let alone being embarrassed in front of the class. Oh my God, she has to go and get a lesson from the nurse because she's fat. To that point, nurses made some creative efforts to minimize stigma. For example, thinking of creative ways to invite children down to their office to be educated without tying it specifically to the HOP program. This nurse provides an example of, I had a little girl who came to my office as a helper in decorating. I said, I need to color these pictures of fruits and veggies, so could you help me do this? While she was coloring the
Dr.
pictures.
Schroeder, 3 minutes more, 3 minutes more.
Thank you. Working conditions played a role as well. Nurses noted, have you ever walked into a medical room in a public school? It's very busy. Nurses can do a lot, but they cannot educate 1,000 children about nutrition, and that's a fact. One nurse saying, I'm so busy, I feel guilty. I want to spend more time with these kids, but I just can't. I just don't have the time. Family socioeconomics also played a big role, perhaps not surprisingly. Some nurses making an effort to let families know that there were area farmers markets available that took public assistance programs to be allowed to pay for fruits and veggies. But considered collectively, looking at the quantitative and qualitative results, we noticed that HOP had low enrollment and intensity, rare parent involvement, and variation in implementation with no effects on outcomes. And nurses faced a fair amount of barriers related to the social determinants of health. They did use some creative methods to overcome those barriers in implementing HOP. And to this end, my colleagues and I took some of the lessons from this and wrote a call to action about the need for school nurses to address social determinants of health and being so well suited to do so. So I have a few thoughts, and I won't go into these too deeply because I want to touch on them in discussion, but when I think about the reasons in this project and elsewhere why nurses may not play the role in social determinants of health that they potentially could, I see a lot of exclusion from their decision and policy making. I feel nurses aren't always prepared for and confident in advocacy and policymaking skills. That's why it's so wonderful to hear about Grace's work. Nursing expertise isn't always valued by individuals in positions of power. I've noticed that not only as a clinician, but a fair amount of times as a scholar. And I think sometimes as a profession, we need to do a bit better job being more outward facing and how we advocate for our role here. However, we have to consider this is all occurring with competing priorities and resource-constrained environments. Nurses are very busy, and sometimes when thinking about how to best address the social determinants of health, whether it's related to this specific obesity intervention or more broadly, nurses feel helpless or powerless because they don't have the skill set or resources to make those type of upstream changes. Yet, I want to close on a note of hope and optimism by saying that I fully agree, as do I'm sure many of you, and that's why you're here, that nurses are arguably among the best suited to address social determinants of health in the healthcare profession. And I'm really very appreciative of the Global Practice Initiative team and the folks on this call doing this work for their work related to this important topic. So for next steps, I'm starting to do some more work. The project I presented earlier was my first work in this space, so I have evolved a lot since then, but I wanted to share that with you because it was very specific to your request for a nurse-led case study. But my more recent work is really thinking more about the intersection of trauma with some social determinants of health, thinking about innovative ways to measure school and neighborhood characteristics, and continuing to work with school nurses, as well as learning every day from my patients to inform the research that I do.
Dr. Schroeder, but that time is up. But thank
Perfect.
you. That was a brilliant. I mean, you showcased the work that you have done that is so impactful, and you also highlighted the challenges, and you pretty much nailed on the purpose of why this initiative was formed as well, as to the importance of nurses' voice and the nurses' role, given that they're the largest workforce in the world, in the healthcare system in the world. Yeah, thank you very much.
Thank you very much. I appreciate that. And I'm going to stop sharing because we're on the last slide here, okay?